Welcome back, listeners and viewers, to our 8th episode in the podcast series From the Margins to the Mainstream, highlighting the journey of the informal waste pickers community in Bengaluru, a community which has been sidelined for far too long and forced to live in the dark. As per a World Bank survey, an estimated 500 million women and girls lack access to menstrual products and adequate facilities for menstrual hygiene management. The lack of means for hygienic management of menstruation can cause discomfort and psychological stress and adds to the shame and sometimes depression that women and girls experience because of menstruation-related taboos and stigma. In India, menstrual hygiene is one of the most critical health threats for women, and they have to undergo several struggles during their monthly period cycle. The National Family Health Survey pointed out that only 121 million out of the total 336 million menstruating population in India use sanitary napkins. Unhygienic practices during menstruation can increase a woman's chances of contracting cervical cancer, reproductive tract infections, various types of yeast infections, and urinary tract infections. We have with us Dr. Arundati Muralidharan, menstrual hygiene and health management expert, a public health professional with close to 2 decades of experience in public health programs, research, and policy advocacy.
Hi, I'm Dr. Arundati Muralidharan and I'm a public health professional, and I've been working for more than 20 years in the field of public health. Much of my work through the years has been on menstrual health and hygiene, where I've had the opportunity to work at the intersection of practice or interventions, research, as well as policy. And I'm here today to talk to you about the status of menstrual health and hygiene in India and what we can do to further kind of catalyze efforts towards ensuring menstrual health for all. So when we look at menstrual health and hygiene, we have to look at actually different aspects of the issue, right from levels of awareness. What do you know? How do you understand this particular issue? What are those social norms, gender norms that affect it? We have to look at access to and use of menstrual products and the wide range of products that exist. We have to look at whether you have facilities that enable hygienic management, which is access to water, sanitation, hygiene facilities. And you also have to look at the disposal and waste management part of it. In addition to this, we also have to look at other aspects which are very intimately tied with menstrual health and hygiene, such as access to health services, nutritional status, etc., which also impact a person's experience of menstruation and how they go about that. Now, when we look at India, we've actually seen that as a country, we've made huge progress because we've seen a lot of investment from the government side, from the NGO side, to tackle this particular issue. However, a lot needs to be done. When we look at the insights and evidence on what we know about menstrual health and hygiene, we see that even today, levels of awareness of knowing what a period is, like what is happening to your body when you have a period, that continues to be low. We still have a lot of adolescent girls who may know that a period is normal, but they don't know that there is something called a uterus. And in fact, that's the source of menstrual bleeding. They don't know what a menstrual cycle is and what happens during that cycle and how that then ultimately results in those 3 to 7 days of bleeding. So while we do see improvements in general awareness that there's something called menstruation or a period, there is growing acceptance that this is a normal physiological or biological function. We see pretty stark gaps in awareness of the female body, the female reproductive system, the menstrual cycle. And that's something that we do need to focus our attention on moving forward. Related to this, we know that menstruation is not just something that's biological. All female reproductive processes are deeply influenced by the socio-cultural setting that we find ourselves in. So what are those social norms, gender norms that affect our experience of menstruation? And in India, as in many parts of the world, we see that these can actually be broken down into certain kind of categories of social norms. There are norms that revolve around our interactions, our social engagements. So for example, you'll hear in some states that एक लड़की अपने घर से बाहर नहीं निकल सकती. She can't sit with other members of the family. She can't go to school during her period. She has to maintain isolation in some extreme cases. So these all relate to her engagements and social mobility. The second relates to the kind of food and the aspects of related to cooking. So one is that you may be prohibited from eating certain kinds of foods for certain misconceptions of how that can affect the body. So for example, in some places you may be told not to eat heaty foods like meat or masala, etc. And in some places you may be told not to eat cooling foods, like dahi, something like that. And because there is an understanding that this affects the body in a way and therefore will affect your period in an adverse way. There are also norms related to a woman or a girl's engagement in cooking. So if you have your period, you cannot cook for the family, you cannot serve the family for a belief that you are impure and that can then contaminate the food that you're cooking or serving. So these are the second kind of beliefs that we have. The third relates to engaging in religious worship. And we see this across religions, that people who are menstruating are not allowed to pray, not allowed to go to places of worship. And for, again, a belief that one is impure. And that you should not be going to a holy place during that particular time. So broadly, we see that we have our social norms in these that fall into these broad buckets. And what we've seen is social norms that are related to religious worship are really hard to break because they're very deeply entrenched in our social fabric. And no matter what we do, it's hard to kind of tackle them because it's also the larger society that we're dealing with. But what we do see is some of the lower hanging social norms, such as those related to food. That is something that we can begin to address. Those related to social engagements, interactions, or mobility or isolation. We're seeing some progress in those fronts as well. So the third big category of work in menstrual health and hygiene is access to and use of menstrual products. And again, here we see that in India now, we've made a lot of progress. 10 years ago, we had an estimated just 12% of people who were using sanitary pads or an hygienic method of protecting themselves during their period. But now, as per the National Family Health Survey, the fifth one, we have around 77% of young women aged 15 to 24 who are using what is called a hygienic method. So we have seen progress here. We've also seen a huge evolution in the type of product landscape that we have in the country. So we not just have sanitary pads, and you have a lot of social enterprises coming up with innovative pads which are eco-friendly or compostable. We also have a huge market for menstrual cups, reusable cloth pads, as well as menstrual underwear. So that's evolving. But it's also important to kind of step back and see that who's having access to these products and do they have access to products of choice? And while we can look at data and say that, wow, 77% of the country is using a hygienic product, when you dig deeper into that data, you see that those with lower levels of education or no education, those from scheduled caste and scheduled tribe communities, those who are older women are actually less likely to use a hygienic method. And that becomes an issue for us. It's a gap that we need to fill. We also are now contending with issues of choice. While sanitary pads are certainly a good option, they cannot be the only option for girls and women and others who menstruate. They should have access to a basket of products. So that's good quality, clean cotton cloth or stitched cloth pads, menstrual underwear, menstrual cups, etc. And I think the task that lies before us is how do we ensure the availability of these products to everyone who has a period, for them to choose what suits my body, what suits my needs, what suits the environment in which I live, and that I can be comfortable and healthy while using that particular product. So we have a lot of work to do on this particular front. The fourth area is on actually water sanitation, hygiene services, and disposal and waste management. Thanks to the Swachh Bharat mission, both in urban and rural areas, we've seen a lot of progress in having household toilets, which has been great, as well as toilets in schools. And so we've seen good progress there. However, now in the phase that we are in now, we need to also look at other spaces that girls and women and others who menstruate are interfacing with. Public toilets, community toilets, toilets at the workplace, toilets in healthcare facilities and other areas. where we need to ensure that we have separate toilets for girls and women and even transgender people who may experience menstruation. We need to ensure that they are private, that they are safe, that they are clean, that they have access to water, that they are functional, so that if you need to change your product when you do, you actually have a safe space to do so that has that basic amenities that enable you to do so. The big issue that we're facing in India is on disposal. If we are seeing such a high rate of sanitary pad use, it's only going to grow. It's a big market. We have to figure out what are we going to do with that waste. While the quantum of waste is quite small compared to the other kind of solid waste that we're generating, it's still something that we need to figure out how to deal with, because there's a certain amount of plastic content also that's in sanitary pads. And here we're seeing that we haven't made as much progress as we have made in the other realms of work, because we still see that in urban areas you're disposing of in a dustbin, but we don't know what's happening downstream. In rural areas, you may be discarding in the open, in water bodies, in open fields. And these is something that we consider that could be unsafe for the person as well and others. The other issue that we're contending with is disposal is when girls and women do not have access to appropriate disposal mechanisms, they're more likely to use a product for longer. And whether that's a sanitary pad, whether that's a clean cotton cloth, whether that's a menstrual cup, that becomes a problem for them. Because if you're using a sanitary pad for 10 hours, 15 hours, no matter what good quality pad you're using, you're going to feel uncomfortable. You're going to experience a rash simply because you can't change it and you can't dispose it off somewhere. So we need to figure out how to tackle our disposal issue. You also asked about across this kind of value chain, what are the differences between urban and rural? Interestingly, given that we are a majority rural country, 30% of the country is rural, but we are also rapidly urbanizing. Nevertheless, much of our interventions, much of our focus has been on rural India and less on urban. We think that urban has greater access to information, greater access to support, greater access to products because you're closer to markets, etc. Now, while that's the case, whatever evidence we have and what we've seen is that's not necessarily true. Girls may have more exposure, but they're, the kind of proper understanding of menstruation and of the body, that still doesn't exist. They may have better access to products, but we do know that products continue to be expensive for them. And the products that they may have access to may not always be the ones that suit their needs given the context in which they're living in. We also see that urban contexts are also very diverse. It's not like a big homogeneous category. You have urban low-income people that are living in very constrained settings. You have slums where you may have one community toilet block that's serving a very large population of 800, 900,000 families. And therefore, this poses huge restrictions on that girl or woman to manage her periods in safety, with dignity, in privacy, and have all the stuff that she requires. Living conditions are more cramped, and that all affects what she's able to do. Now, one thing that we see in urban, especially in urban low-income areas or in even middle income, higher income, is we're living in nuclear families. So it's harder for us to very rigidly practice those social norms such as seclusion or don't enter the kitchen, because if the whole family is not engaged in doing that work of cooking or serving or cleaning the house, then how is that family going to be able to make it, right? So so certain social norms we've been able to, I think, overcome because of necessity and the way that urban living is structured in nuclear families and very constrained settings. But there are other social norms that we haven't been able to address that much. So this whole thing of menstruation is impure, that still continues in our minds. And I think that there is a need to look at urban context given urban constraints, especially with low-income communities, and figure out that in terms of product access, product use, access to safe and private toilet facilities, and the big looming issue of disposal and waste management, that's something that's very, very stark in urban areas. So that's something that we do have to look into as we take the work in rural areas forward.
मेरा नाम फरीजा, मैं कलकत्ता से आई हूँ इधर 4 साल हो गया। यहाँ पर प्रॉब्लम पानी का, बिजली का, वो बाथरूम का, वो नाली का, बारिश आएगा तो नाली में पानी नहीं जाता, अंदर में चले जाते घर के अंदर, पानी का लिए प्रॉब्लम है। और यहाँ पे हम लोग यही कचरा का काम करती थी, और हम लोग कुटी घर में काम करती थी, आदमी लोग इधर काम करती थी। ठीक है। तो गाँव में काम तो नहीं है, इधर काम ही है, इसीलिए कोलकाता छोड़ के फिर इधर आया, बेंगल में आई थी। तो इधर प्रॉब्लम बच्चा के लिए, स्कूल के लिए प्रॉब्लम, बच्चा के लिए। यहाँ के पीने के लिए अलग लेती, फिर नहाने के लिए वो अलग आती, तो ज़्यादा पैसा लग जाते हम लोग का। महीना में 2000 लग जाती पानी के लिए, यही दिक्कत है। और टॉयलेट के बहुत प्रॉब्लम है, हम लोग को धूप इधर जाती जंगल में।
We're not able to actually clearly differentiate because we don't have, there are several small studies, so we don't have some kind of meta-analysis, a more recent one that helps us see this. But there was a meta-analysis that was done about 6 years ago that showed that in terms of awareness, there's just a marginal improvement in urban over rural in terms of girls who knew what the source of menstruation is. There are some differences when you look at waste management. So for example, in urban areas, you'll have more people say कि हम dustbin में फेंकते हैं, that that wherever you're collecting the household garbage, the used pad is going there, whereas in rural areas, you're more likely to hear people saying हम बाहर फेंक देते हैं, या we burn it outside or we discard it wherever we can. So there are these kind of differences. The other kind of stark difference is, I would say, in product use. You're more likely to have people say that they use a sanitary pad in urban areas as opposed to rural areas, though that gap now is slowly closing. But that's the other one. So in urban areas, you may have 80 or 90% who are using sanitary pads, but in a rural area in that same state, you may have, say, 50 or 60% who are using sanitary pads. So I think there are these differences, but frankly, this kind of data is masking the similarities that both urban and rural populations, the similarities in both in terms of requiring access to information and education, requiring access to better products that meet their needs and better solutions. So while it's important to look at these differences, we should be careful about positioning urban as in a much better state, because it's also who are we looking at within urban. Because if you start looking at the slum population in any city, whether it's Delhi or Mumbai or Hyderabad, Bangalore, etc., you see that they are not doing as well as the middle and high income groups. They are facing very similar constraints as rural areas, which are magnified by those living conditions which are quite dire for many of them. So the informal waste worker community, one is, I think, they're facing several challenges with regards to their daily lives. And then when you look at menstrual health and hygiene, it's positioned within that. One is, given their daily lives, it's sometimes hard for them to prioritize menstrual health and hygiene as a need. So if you go into any waste worker community, you also realize that they're facing numerous other health issues. Their kids have diarrhea, they've got cuts, sores, other kinds of infections. And that becomes a priority because that's something that they're dealing with, and that's affecting them or their children a lot more. And then the issue of menstrual health and hygiene, I see, takes a bit of a backseat. They're like, ये तो होता ही है, we have to figure out how to deal with it. But बच्चे को दस्त है, and that takes priority. I think the other big issue that we see with informal waste workers is the fact that they are working women and they're spending a certain part of the day, whether they're beginning their day at 4 a.m., where they're out for long stretches of time, collecting that garbage, is that then they're out of their home and they require menstrual materials that can provide them with that level of protection that they require when they're working. And that's something that we have to figure out. Is sanitary pad a solution for them, or can we offer them another product that can provide them as much protection and also be more convenient or comfortable for them? And that's something that I feel that we haven't dug into that as much. I think one of the biggest issues that we find with the waste worker community is when they come back, they are also sorting garbage there where they live. It's not that is happening, removed from their living situation for many of these communities. And that becomes a huge hygiene issue. We're not providing them with protective equipment, and they don't have gloves and masks and boots and everything. So they're doing that right there. And then they have to change their menstrual materials. Now, that's quite challenging for them. We also see in many of these informal communities, they don't have access to even a community toilet complex. So where will they go to change their materials? Where will they go to wash their hands? I mean, one of our MHS messagings is, wash your hands before and after you change your menstrual material. But where will they go? How will they do this? If we offer them a cup or a cloth as an alternative to a sanitary pad, how will they use these products? A cup requires insertion into the body, which requires clean hands. Where will they wash their hands? If we provide them with clean, stitched, beautiful menstrual cloth to use, again, that's an issue, because where will they wash it? Where will they dry it in a clean place that reduces their risk of infection? So I think that these are some huge issues. One thing which remains consistent, whether you're a informal waste worker, if you're a woman working in a factory, or a girl going to school, is the levels of awareness. Many of these women may not be educated. And therefore their understanding of their bodies, what's happening to their bodies, why do they experience menstruation, what are the is something a menstrual problem, is it something to be taken more seriously? This level of awareness continues to be low with this group, as with many others as well. So in terms of the challenges that they face, I would say it's across that value chain of information, product access and use, having a safe space to change, private space to change, and being able to dispose of. And it's magnified because of the type of work that they do, and frankly, the living conditions that pose huge challenges for how they're able to do this. I would say go back to the basics when we're looking at what do we do for the solution. Start with they need information about their bodies. Tell them about what's happening in terms of the reproductive system. What is menstruation? What's the menstrual cycle? Help them track their menstrual cycle. Help them identify whether things are normal and what could be seen as something that's not quite right, that they may require to go to a doctor. So I think that awareness is something that needs to go across the board. Any girl, any woman, any person who menstruates must have knowledge of that body. That body literacy is critical. So I would say that's number one. The second is, instead of pushing one product at them, we should actually expose them to the product basket and say that, okay, this is your living condition. This is what you have access to in terms of toilet facility, water, privacy, whatever. This is what your daily schedule is like. Which product do you think can suit your needs best? And it need not be one product. You may want to use a mix and match approach. Sometimes if you're going out for waste picking, you may want to use a sanitary pad. When you're back home, you may want to use a kapde ka pad. You want to use a menstrual cup. But I think now we really need to ensure that these communities have access and knowledge about this range so they can figure out what's best for them to use. The third is, I think that we need to provide them with access to toilet facilities, water, which is relatively close to where they're living, so that in order to maintain hygiene and to prevent infections as a result of poor menstrual hygiene, you need access to clean private toilet facilities that have water as well. They need to be able to have washing facilities so that they can bathe fairly regularly. And I think that's something that is an infrastructure fix that needs to be done, and then figure out how that can be made more supportive for them. Disposal is going to continue to be an issue. While they are engaged in waste collection and waste sorting, they will also have to dispose of their own menstrual products. But the thing is, this is not just for that particular community. I think us as a sector, as those of us who are working in this, we need to figure out more efficient and effective ways for waste management, especially with these different groups, urban and rural. What will work where? It can't be a one size fits all, but we will have to come up with a compendium of solutions and then pick and choose what will work in those particular contexts. So we have a fair bit of work. Like, we know the roadmap is there. We know that we have to work on these pillars. I think we have better solutions for some of these areas, like awareness and products. And we have a lot more work to do in something like disposal and waste management. As we have done in the past, there's great opportunities for us to come together for two reasons. One is, government is the one that is the body that can deliver programs at scale. As civil society, we cannot reach the numbers that government does. And I think that's a huge benefit of where the government has that strength. We also see that government for over 10 years has committed to addressing menstrual health and hygiene. and across departments, whether it's education, health, women and child development, water sanitation, there's been a commitment at a national and at a state level to do this. So I think that's the second big positive that we have, that the political will and programmatic, commitment exists. In terms of civil society, what civil society does is, I think they do a very good job of two things. One is innovations. So testing out new types of interventions, whether it's a product intervention, whether it's a behavior change intervention, whether it's addressing social norms, whether it's coming up with disposal solutions, So both in the soft and the hardware, they're coming up with solutions and innovations. And that government can see what they can then scale up. So I think that's one very big positive of civil society. And the second is, civil society also has a lens on who's the most vulnerable, who are those marginalized groups, who are we leaving behind, who's hard to reach. And they're figuring out, okay, how do we work with these populations? And the waste worker population is an example of this. They've identified as a group that is particularly marginalized. They lack access, even though they are in the middle of a city, they're lacking access to a lot of services and other entitlements. And they're trying to figure out, okay, how do we support this particular community? So again, this could be a great partnership where civil society brings in the innovations, reaching out to those who are hard to reach, those vulnerable and marginalized groups. And government is the one where we see that big political will, we see that capacity for reach. And we have to figure out how we can draw the lessons from the two to bring them together so that we're able to have greater impact at scale. I think another thing that civil society can do and has been doing is evidence generation. That what do we know about what's working on menstrual hygiene? Who's doing, anyone who's engaged in research, whether it's from a program point of view or got a lot of academics in India who are doing research on this issue. And then again, those research insights as to what's the status, or kind of evaluation, assessment studies that let us know what's working, where is it working, why is it working, at what scale. That's also hugely beneficial to those of us in the sector as well as government. So we can take those learning and government can amplify it, learn from that and see, okay, what do we need to do and what can we do about it? So gender equity and equality, I mean, these are things that we're grappling with, trying to understand what do we do. I think a very basic, again, I think we can break this down into several ways, but a very basic thing is, this is not just an issue that's affecting menstruation or menstrual hygiene, menstrual health. Issues of gender inequality are affecting girls and women and people with gender diverse identities per se. It's affecting their access to information, it's affecting their access to services, it's affecting whether they go into school, whether they can work, whether they have a say in their families. And that goes back to issues of, girls and boys being valued very differently. It goes back. So I think that in order for us to be able to address menstrual hygiene, we also have to see what we can do to reduce some of these disparities that we have between the genders. So I think that's a bigger battle that we're facing, that we are trying to do in various ways. So if you look at education space, they're trying to ensure that girls are going to school and staying in school. You've got nutrition interventions that are focusing on adolescent girls and women so that we're ensuring the nutritional status is better. With menstrual health and hygiene, we also kind of try and tackle these gender inequalities in a particular way. It may be related more to menstruation, but it kind of associated with the larger aspects. So here, I think interventions will start at trying to normalize menstruation and first of all say that this is something that's a normal biological process. And once you're able to understand that this is something that is normal, there's a function that it plays, and that menstrual blood is not impure, it's not a curse, then that's helping to address this to a certain level. And it makes girls and women not seem impure at that particular time. The second is to also then engage other influencers who are working with girls and women on this particular issue. So it could be other women in the family, it could be other women in the community, it's boys, it's men, it's community leaders, it may be religious leaders as well. Because while we are going to them talking about menstrual hygiene, The aspects of those social norms or gender norms that we're talking about also then relate to other aspects of girls' and women's lives. So if we tell them that, this is important, girls require support, they require access to clean and safe toilets, they require access to products, they should not be considered impure, they should have freedom of mobility, etc., etc. And how can they play a role in changing the status quo and shifting these norms towards more positive norms? Then we can see that they can be, we're slowly and, kind of chipping away at some of these issues. That said, this is, gender equality is something that we're not just going to be able to achieve through work on menstrual health and hygiene. It requires a very multi-sectoral approach towards doing this. And this is where I think the power of, as civil society and as government, that we start working with other sectors that are dealing with this. So whether it's those working on girls' education, ending child marriage, dealing with gender-based violence, we need to engage with them, and so that we're able to address this issue in a far more holistic way, while we continue the work that we do in addressing these, gender norms through our MHM or MHH work. We need to start engaging with these other players who are also tackling these gender inequalities.
In our penultimate episode of the series, we are going to be in conversation with Ms. Chandra Ganapathy, who has an extensive experience in the wash sector and will be talking to us about the importance of ensuring sustainability of all interventions through active community participation and involvement.